Over 1 million heart stent procedures and nearly 500,000 coronary bypass surgeries are performed every year in the U.S., but a huge new study shows a lot of them could probably be avoided. We have Dr. Marty Makary still with us and cardiologist Dr. Kahn joining us also now via Skype. Dr. Kahn, you may have been privy to our previous conversations talking about unnecessary surgeries being performed. Can you tell us about this new study as it relates to cardiology?
Yes, and this is the most massive and most expensive cardiology research study ever done on the core issue, what you just mentioned, 2 million procedures a year in the United States that cost us $50 billion and that do cause some people to have strokes, infections, and even die. These are big procedures, bypass and stents. So our government and other governments around the world took 5,179 patients with stable ischemic heart disease. They got that awful feeling called angina pain most of the time. Then they did a stress test, and they did poorly on their stress test. Some of them had a CAT scan that actually identified how badly blocked their arteries were. And some very bold patients and researchers said, all patients will learn about diet, exercise, and get on really good medication like little old aspirin and other prescription drugs. Half are going to go straight for the catheterization, and based on that, 80% of those had a stent or open heart surgery. The brave 50% were left on medication, diet, exercise, cardiac rehab, and over the course of 4 years, they looked at what happened. So that was the setup of the study.
So what happened to the folks that did not get the stent or the bypass surgery when normally they would have?
Yeah, actually, at 1 year after they were randomized, there were fewer strokes, heart attacks, and death if you got the pills, the diet, and the fitness program compared to the big procedures that are, quote, curative, but we learned maybe not. At the end of 4 years, the death rate was equal. If you kept having angina pain after you were randomized, you did have less symptoms if you had the stent or the bypass. Many of the people in the study, though, had very little chest pain before, and the bottom line was if you have blockage but no symptoms and you fit the criteria, you had absolutely no advantage going through your chest getting cracked or a stent being placed from your leg or your wrist. There was no advantage for quality of life or pain. If there was a lot of angina, you could argue will make their quality of life better, and that's a judgment between a patient. But this is radical and revolutionary, not for the person in the emergency room or the coronary care unit on the verge of a heart attack and truly unstable, because this was stable patients. They were allowed to go home and think about all this. And I have a rule, if you're allowed to go home, you need to really consider if you need these operations at all, get with somebody who can give you the full story, the ischemia trial results.